Maren Dunn is board certified in family medicine. Dr. Dunn has lived in Big Sky for 9 years and has worked in rural family medicine since 2005. She is the board president at Morningstar Learning Center in Big Sky and has a first grader currently at Ophir School. Dr. Dunn, thank you very much for joining us this evening.
Thanks for inviting me.
Yeah, of course. Let me just start with maybe just an obvious question for you. Is it safe for kids to return to the classroom right now?
So that is the question of the day. That has come down to essentially two items. Number one, the number of COVID exposures and COVID numbers in the community. Mm-hmm. And then what are the schools doing to mitigate that possible spread? You know, Gallatin County has done a great job, and Big Sky is also low in the COVID numbers in terms of flattening the curve. So in that regard, our numbers are low. So that is a good reason why children should be able to go back to school. Secondarily, our school's done a great job. Both of them have done an excellent job in mitigating the risks. They've followed all the CDC recommendations. They've taken it to the highest level, also in terms of the risks that are inherent for kids that have high risk, that are high risk themselves, or maybe live with high risk people, in that they can stay home. So I think that answers your question. It does come down to numbers in the community and what schools are doing about it.
Sure. Talk a little about what you think are the pros and cons to returning to in-person learning.
Gosh, the pros are far outweigh the cons, especially for the young kids. But I think it goes all the way through the college kids, as we've heard from both others on this panel. The kids don't just go and read and write and learn math. They learn social and emotional skills. They get social support. They get to go outside and play. They are fed. These are all really important public health components to a healthy community. A lot of times, and even in our community here in Big Sky, school is a safe place for kids. You know, they'd be home alone otherwise, and that's not always advisable. So I think it's important that the kids go back to school. I think that the CDC and the AAP are both very much in fact, I know they're both very much in favor of schools as long as it's safe for children to return for those reasons. Mm-hmm.
Dr. Dunn, what are you seeing in Big Sky right now related to COVID-19 cases?
Not much. I mean, we have been very, very lucky in the county, in Gallatin County also. Our surge, if you could call it that, is mild and minor compared to the surges that you hear about on the television. And I don't think it's just because our population is small. I think it's because people did the right things. We did completely flatten our curve before opening the state back in June. Mm-hmm. So we knew what to do. And I know that as a local person here in Big Sky, and my friends who are locals and people who locally live here, we hunkered down even when the droves of people showed up. We didn't go out. So all of us, especially with children where we want them to go back to school, where we wanted the daycare to stay open, have followed the guidelines.
Yeah, that's great. Today we talked about is Big Sky School District's first day back in school, and you have a first grader at Ophir. She was in the 50% of the students who stayed home today. So tomorrow's her first day, Ruby, right?
Yeah.
How's Ruby doing? How is she handling some of these complicated times?
You know, I have to say that I have been more than impressed. I've been blown away, actually, not just by my own daughter or her friends, but all of the children that I meet through my practice at how plastic they are, how well they can accommodate for changes, how well they communicate, how attuned already to, the online environment they were to begin with. Mm-hmm. I think that also speaks to their relationships with their teachers. And I can't speak enough to the teachers and how much they did to make that easy for our kids. And so my kid's not afraid to go back. She's not worried that she's going to go one day and come back and do online the next. It's just what she's now used to. And the teachers really have a lot to do with making that a simple process, even for us parents who are not teachers but have become teachers, and for the kids.
Yeah, yeah, absolutely. You know, it's interesting. You talk about, you know, we talk about the students and the, you know, the difficulties adjusting to distracting times and, you know, washing your hands out every 3 seconds and masks and distancing. You know, I think that's something that's maybe a bit overlooked too. I'm sure, you know, teachers have had a very difficult time with this, and you probably have some. We both have friends in the school district, and how are the teachers doing from what you've been able to notice?
Again, all I can say is that the entire education, that part of our community is remarkable, resilient, remarkable, energetic, excited. I saw Ruby's first grade teacher at the farmer's market, and she was practically jumping for joy to tell me that, you know, for us to be excited, we were all excited that Ruby was going to be in her class. You know, it's exciting. It's always an exciting time to go back to school. I don't think it matters whether you're a college student or a kindergartner. So the teachers that I'm aware of, they're ready to go. This is what they do. You know, they solve problems, they develop curriculum, they pull the kids out that fall into the cracks. And that's all I have seen. Sorry about that.
Okay.
That's all that I have seen from my perspective.
Well, I just want to jump back into you know, some of the government protocols and directives. You know, the CDC recently changed its guidelines from encouraging those who have been in contact with known cases to get tested. Now, the CDC is discouraging these folks who are asymptomatic. I was wondering if you could just if you could give us your take on this change.
The change has a lot to do with the burden on the medical community, essentially. I mean, when you talk about testing someone, you are getting that very specific second in time. Whether or not they have the virus could change within an hour, whether it shows up on a test. So the test is really not relevant. What's relevant is how smart are these people being that are coming in contact with folks who we know are positive? Are they quarantining, relative quarantining, whatever they feel is appropriate to the amount of time they spent or how close they came to that person? And are they doing their own due diligence to quarantine? And if they were to become positive, by all means, test. Testing asymptomatic people has just not been proven very useful. It certainly isn't changing the rates of exposure, and it's not changing the rates of escalation either.
Yeah. Interesting. Yeah, because they are doing it to some degree on the state level, and MSU is considering those, but I can see where you're coming from in that it's a snapshot in time and it doesn't help you yesterday or tomorrow.
And this is also, I mean, the CDC made a specific recommendation for schools, and that's because their expectation is that schools are going to be following all these precautions. In other places, such as in Big Sky, where there are large construction sites, that's a different story. That is not a school where precautions are being taken. And should those people be tested asymptomatically? Well, that's going to be up to that organization. That's a very different picture. We're just talking about schools today, so.
Sure, absolutely. And yeah, okay. Talk to me about just the importance of wearing a mask. And are there contraindications for masking up?
So the American Association of Pediatrics recommends starting at age 2. The children that shouldn't wear it are either under the age of 2 because they really can't manage a mask. They can't take it off if need be. Or other kids who are not able to function with it on, can't take it off, can't take it on, put it on, things like that. So by and large, 99% of children can wear a mask. The purpose is to limit the amount of respiratory droplets that travel into the air. The more we do that, the less likely a virus is to travel. Also, the less likely the recipient of that virus, should it be in the air, is to get a very high dose. And we know that COVID-19 illness is much worse in people who get a larger dose of virus than those who get a lesser dose. So you're not only protecting yourself, you're also protecting others.
Mm-hmm. Yeah, no, absolutely. And a lot of people have pointed to the respect factor there for people who may, have underlying conditions. Well, look, Dr. Dunn, thank you very much for your time today. I'd like to kick it over to Brandon just for any follow-ups or audience questions that we might have.
Yes, thank you, Joe. Dr. Dunn, I'm curious on a total personal note, will Ruby be taking her back to school photos with or without her mask?
That I don't know. I guess Dr. Shipman, will they be taking class photos without their masks?
Oh, I think you're on mute there.
That's yet to be determined. But a lot of parents took them with and without this morning at the sign when they were dropping off.
Awesome. Well, thank you.
It seems to me that's going to be a rite of passage for 2020.
Yeah.
Well, thank you for your time, Dr. Dunn. We appreciate it and wish you the best of luck with everything this fall as things continue to progress.
You're welcome. Thanks for inviting me.